It's important that we strengthen our muscles, and it's important that we take responsibility for these things and not just expect that when you roll into the hospital that they're going to take care of you. You're losing muscle mass, and sooner or later it's all going to come tumbling down. These machines help prevent it too. So if patients are really engaged in trying to stick around for 100 years, good quality 100 years, like my mother and myself are, use the machines. She gets therapy all the time.
So tell me a little bit, what is this thing?
That is one of the applicators of Emsculpt Neo. So the Emsculpt Neo is a device that provides high-intensity, focused electromagnetic pulse waves. Now, there's various manufacturers of electromagnetic devices. The pulse wave technology has been around for several years now. But this is the most powerful machine on the planet. And this has dual purpose. So we can build muscle, but we can also burn fat. We can also work on joint work. We can actually help restore function of joints. And on our website, we actually have some video testimonials of patients. Like there's a lady recently that came in, new resident in town, and she's, for the past 5 months, Renee has had a rotator cuff tear with a slap tear of her glenoid labrum, which means that there's a portion of the labrum, which is a little structure that is very important that surrounds the articulative surface of where the humerus articulates with the glenoid fossa, which is a part of the shoulder blade, if you will. And where those two come around, there's a tear that sometimes occurs, and it's called a slap tear. So that tear, when that structure gets irritated, it's like, whoa, it's super painful. This happens a lot with athletes. This happens a lot with people who take falls or repetitive injuries, repetitive stress injuries. So we took that machine and we actually paired it up with another one we'll talk about in a minute, which is the M-Vital, the brand new laser, which is a robotic controlled laser, which is unlike anything that I've ever worked with. And I think this is my 9th laser. This blows everything out of the water because, number one, it's at a waveform that's very, very powerful and very good at penetrating deep. We can get into almost 2.5 inches under the skin, which is just unheard of.
That's wild. I had I was thinking you could just put a heating pad, but this is like a whole nother level of.
This is decreasing inflammation, increasing circulation, stimulating the mitochondria to go on full alert, bringing energy to the tissues to begin the healing process, unlike any other laser I've used. And I've had 60-watt lasers. I've had various ones. I don't even want to mention the names because I don't want them getting mad at me, but they're all crap compared to the M-Vital. And I'm not getting paid by them to promote this laser just because, I think it's, something new. This thing works. And if you look on our website, you'll see our patient, Renee, and she gave us permission to post it. We were all in tears after seeing her motion from the first time after 5 months, what she could do. She couldn't bring her arm any farther than this back. She couldn't really go any farther than this prior to putting the laser in. And she said, "Oh, this really scares me," to reach around back to pull her pants up. We did 15 minutes of that laser and she's like, "I can do it." She started crying. Then we backed it up with Emsculpt Neo.
So this device right here,
that one right there, which is the HIFEM, high intensity focused electromagnetic pulse waves, which is going to do 20,000 contractions in. Yeah, I know.
So this is it right here. Where
that's where there's actually a coil of energy that's in there that's going to emit energy out, and then there's a sensor there that reads, and it will also emit infrared heat, and that heat is going to warm up the tissues when it comes to. When it comes to preparing the tissue for activity, just like when you warm up your muscles, the machine was going to warm up the muscles and then we're going to pulse it with these pulse waves, which just rehabilitates the tissue, makes the pain go away. It modulates pain, it increases strength. It's just a fabulous tool. I can't practice without it anymore. I mean, it brings everybody to a level of health and rehabilitates their injuries at a whole different level, so much quicker.
Yeah, it's amazing. It's an amazing device. And for a lot of the people that probably can't even see, there's a whole, piece of equipment that gets brought around from it. This is just the paddle that I imagine gets like attached to the body.
That's correct. And there's 3 different paddles at this time. They're constantly developing more. That little button that you see there is a on-off switch, so the patient always has control. Yeah, they put their middle finger over that and they just press it to turn it off. Yeah, so in case they're ever like, oh, it's a little bit too much, they can interrupt the therapy. There's 2 paddles that we use there, or applicators, and then we have 2 other sets for different body parts. So we can. The reason I bought this is to help rehabilitate patients that have severe issues. I heard that they were coming out with functional protocols, that they just got FDA clearance for chronic intractable pain, post-surgical pain, acute and chronic foot drop. Peripheral neuropathy. So people that have diabetic neuropathy, peripheral nerve problems, they got clearance for this to be used on that.
And this will help stimulate the neuropathy, like to reduce it, or
to help reduce neuropathy and to regain function. It's all about function. Pain is a terrible thing, but if we can get people to function better, then they can augment their therapeutic rehabilitative process with therapies like this.
Yeah.
So post-surgical pain also. This is just a godsend.
I was going to say too, like what about after birth or something, like a woman? Is that something that could be used for this? Like
Absolutely. They have, when a woman gives birth, many times they have what's called diastasis recti, and it's like a splitting of the abdominal region.
Yeah.
And this has been shown to drop it by 20% in as little as 4 treatments. The treatments are spaced out 1 time a week. They don't hurt. They're on the machine. They're laying still laying on a table. They can be reading or on their phone for 30 minutes, and it's helping close that gap. It's helping strengthen that region. We can also burn what's really dangerous, what's called visceral fat. We can do different therapeutic procedures with this machine. It has a functional program. It has a sculpting and heat and fat burning program. We can dial it in to do different things, and using the different applicators, work all over the body. We can burn gluteal fat, or we can build the gluteal muscles. Many times you want to leave for form. You want to not burn too much fat. You just want to build the muscle to give a nicer anatomical look, let's say. We can build quad strength. Most importantly, for anterior compartment syndrome in the lower leg, we can work on that and help patients regain dorsiflexion. We use this when needed. But honestly, if people were to start doing stretches, if they were to start like getting out of the chair, like every day when I'm at the edge of my bed and I go to get up, I use my legs. I don't ever push myself out of bed. Use your legs and stand up straight. Go for a walk. Halfway through your walk, stop and do a few minutes of yoga. You're losing muscle mass. And sooner or later, it's all going to come tumbling down. But you can prevent that. You can prevent it a lot. These machines help prevent it too. So if patients are really engaged in trying to stick around for 100 years, good quality 100 years, like my mother and myself are, use the machines. She gets therapy all the time because it just helps. And it's like, come on, Mom, sit on the chair. Sit on the magic chair. Let's put some of this on you. It's important that we strengthen our muscles, and it's important that we take responsibility for these things and not just expect that when you roll into the hospital that they're going to take care of you, because that's not a healthy and fun place to be. You get in there for a couple of days, you can't wait to get out. And many doctors will say, let's get you out of here fast before you catch something.
Yeah, very true. Very true.
Man, I'm just rambling on.
No, you're talking well. This is good. I want to switch it out with I want to talk about another one.